Hello, my name is Daisuke Hayashi, and today I will be presenting to you the preliminary results from Brazil of the iCARE study on behalf of the iCARE study team. The principal investigators of the study are Professors Kim Lavoie and Simon Bacon, who lead the Montreal Behavioral Medicine Center. I am part of the analysis working group along with PhD student Ariane Vieira, postdoctoral fellow Giovanna Stojanovic, and systematic review specialist Dr. Paula Ribeiro. The iCARE study is an ongoing large-scale multi-wave international study of public awareness, attitudes, concerns, and behavioral responses to public health policies. 150 international researchers from 40 different countries are part of the study that has heard over 50,000 people around the world. Ultimately, the study aims to contribute to the development of policy briefs for government officials and to find the best ways to reduce the spread of COVID-19 from a behavioral perspective. Today I will present you the data from the first wave of the study in Brazil. It is known worldwide that Brazil is currently one of the most dramatically affected countries by the COVID-19 pandemic. The first wave of data capture of the iCARE study in Brazil took place from March 29th to May 5th. Using data provided by the Johns Hopkins University, we can see that the aforementioned period represented an interval in which the number of confirmed cases in Brazil started to rise significantly, from the first confirmed case to over 115,000 cases. All respondents who reported residence in Brazil, regardless of survey language, were included, and the data will be presented as proportions of total responses. The option I don't know or prefer not to answer are not applicable was considered as missing values. The primary outcomes included COVID-19 prevention-related behaviors, and all the behaviors included in the analysis regarded personal hygiene, respiratory etiquette, and social distancing. The first wave of data collection had a total of 741 respondents from Brazil, most of whom were females highly educated and living in urban areas. As you can see on the map, over 90% of respondents were from the south and southeast of the country, represented in red and green respectively. The behaviors with the best adherence were hand washing and staying home, followed by staying at least 1 to 2 meters away from other people and self-quarantining if they believed or knew they had the virus. Coughing and sneezing into the elbow and using hand sanitizer frequently had over 50% of most of the time answers. Interestingly, wearing a face mask was still uncommon with only 10%. Regarding the perceptions of government measures, over 90% of participants perceived the measures as very important. As for their level of strictness, participants were most likely to perceive them as either adequate or too lenient. Moving on to the health-related concerns, it is possible to notice that concerns related to the own respondent's health, such as being infected or the health risks associated with it, were less likely to be present to a great extent than the concerns related to others, represented in green. A similar phenomenon can be seen in the results regarding economy-related concerns, where the concern for the country's economy, represented in green, was more often considered present to a great extent than the concerns for one's own finances. People were also relatively less concerned with being isolated than with a possible lack of food in the grocery stores and the uncertainty of when things would get back to normal. Like any other survey-based study, ours is not devoid of limitations. There was a selection bias in which the majority of participants were from the southern regions, affecting the ability of the study to represent the rest of the country. The use of snowball sampling made the study rely on the researchers' network of personal contacts, which explains the highly educated sample. To summarize our results, government measures in Brazil were perceived as important, yet somewhat lenient, and there was a very low adherence to wearing face masks, which may be due to cultural factors. Additionally, there were higher levels of concerns related to the community than to the individual well-being. The next steps of the study will be defining research questions with the help from international collaborators, investigating correlations and associations between social demographic factors and behaviors, performing principal component analysis in order to identify the different domains of COVID-19 related concerns, and finally linking survey data with policy and case data to provide the Brazilian government with recommendations from behavior change specialists. Lastly, we invite you to take the survey and to share it with your personal contacts. You can easily do so by accessing the website showing on your screen. You can also learn more about the study as we keep the website updated with the latest news and data. Follow us on Twitter and feel free to contact us at the email address on your screen. And finally, thank you for watching our presentation.